So good morning again. So today we will be seeing about the anatomy of the gastrointestinal system. Okay, the GIT or the gastrointestinal system. Now, what does this gastrointestinal system include? It starts from the oral cavity. Okay, it starts from the oral cavity until the anal canal. Okay, the anal canal. Okay, so now you know the food which passes first enters into the oral cavity, then from the oral cavity it goes into the pharynx, and from the pharynx it goes into the esophagus, and from the esophagus it goes into the stomach, and from the stomach it goes into the small intestines, and from the small intestines it goes into the large intestine, and from the large intestine into rectum and anal canal. So this is the normal route or the passage of the food. Okay. Apart from this, the normal food passage, which is called as the gastrointestinal system, there are some strong organs which support the gastrointestinal structures. Okay. So that is the food does not pass through these structures, but they help in digestion. So what are these? The salivary glands which secretes the saliva, the liver, okay, you can see the liver, the pancreas, okay, the biliary duct, and the spleen. The spleen is not shown. Okay, so these are the structures, the accessory GI structures. They are also part of the gastrointestinal system, but they do not come in contact with the food directly, but they help in digestion. Okay, so these are called as accessory GI structures. Now let's see each one of them in detail. First, the oral cavity or the mouth. The mouth can be divided into two parts, which is the vestibule. Vestibule is the part between the gums and the cheeks. That is where we brush. Okay, that is where when we brush, we keep the brush in the vestibule between the gums and the cheeks when we brush, right? So that part is called as the vestibule, and the oral cavity proper, that is within the teeth. Okay, that is within the teeth. That is called as the oral cavity proper. So two parts, oral cavity proper, and the outer part is the vestibule. Now the oral cavity proper, there is a hard palate because it is formed by the palatine bone, and the lowermost portion there is soft palate because there is no bone here. Okay, because it's formed only by muscles, so that's why it's called as a soft palate, hard palate and soft palate. In the soft palate, in the center, there is a structure which hangs down, and that's called as uvula. Okay, which is called as uvula. Okay, and here will be the pharynx. On either side of the pharynx, there will be a tonsil which is called as palatine tonsil. Okay, we have already seen this in the respiratory system, the upper respiratory tract, the palatine tonsil. Okay, so this is the palatine tonsil. So oral cavity, hard palate, soft palate, uvula, and the palatine tonsils. Another important structure which is present in the oral cavity is the tongue. The tongue, it is attached to the bone, which is the hyoid bone. Okay, and it is also attached to the base of the oral cavity by means of a frenulum. If you lift the tongue up, you will be able to see a structure which is holding it into the floor of the mouth. This is called as frenulum. Okay, the blood supply of the tongue is the lingual artery. Okay, the lingual artery supplies the tongue. Okay, the most important one in the tongue is the nerve supply. Okay, so definitely at least two questions will come from this. So what is the nerve supply for the tongue? The anterior two-thirds of the tongue, okay, the taste, the tongue has got taste, has got a special sense which is called as a taste. So the anterior two-thirds, the taste is by means of the facial nerve. The facial nerve, which is also the seventh cranial nerve. Okay, this is the Roman letters. So this is the seventh cranial nerve or the facial nerve. So the taste from the anterior two-thirds of the tongue, it is by the facial nerve. Okay, and the general sensation. What is the general sensation from the anterior two-thirds? It is by the lingual nerve or the fifth cranial nerve. Okay, the lingual nerve or the fifth cranial nerve. What is the difference between sensory and taste? Taste is a special sense. Okay, sensory, general sensation. General sensation means like touch, pain, temperature, okay, pressure. So those are the general sensations. So when we take some hot food, okay, so our tongue also feels that hotness, okay, or some bone which pricks in the anterior two-thirds of the tongue. Okay, so that is being felt. That is by a different nerve. Which nerve is that? That is by the lingual nerve. Okay, so your questions can be clinically based. Say they will ask a person is coming, okay, with loss of sensation in the anterior two-thirds of the tongue, but there is taste present in the anterior two-thirds of the tongue. So which nerve is involved? Okay, so you need to analyze and then tell. Okay, so what they ask is only anatomy, but they might ask you to answer questions indirectly, okay, through a case scenario. Okay, so in the anterior two-thirds, the special sense, that is the taste, is by the facial nerve, whereas the general sensation is by the lingual nerve, the lingual or the fifth cranial nerve. Okay, the posterior one-third. The posterior one-third, both the taste and sensory, it's by the glossopharyngeal nerve. Glossopharyngeal or the ninth cranial nerve. Okay, the glossopharyngeal or the ninth cranial nerve. Okay, both the taste and general sensation is by the glossopharyngeal nerve or the ninth cranial nerve. Okay, so you might be asked either facial nerve or they might give you this one only. Which one? Seventh, okay, fifth, only these numbers will be given. Okay, so note down this one also. So glossopharyngeal, this is ninth cranial nerve. Okay, 1 and X. Okay, this is Roman letters. So this is the ninth cranial nerve. Motor for the tongue muscles. This is sensation. Okay, the tongue also moves whenever we speak or whenever the food goes inside. Okay, it helps in digestion. In the tongue moves, and movement of this tongue is by means of a special nerve which is the hypoglossal nerve or the 12th cranial nerve. Okay, so the motor for the tongue muscles, it is the hypoglossal or the 12th cranial nerve. Okay, so the anterior two-thirds, taste is by the facial, whereas general sensation is by the lingual or the fifth cranial nerve. Posterior one-third, both it's by the glossopharyngeal or the ninth cranial nerve. The motor sensation, it is by the hypoglossal nerve. Okay, so this they might ask you in the form of case scenario as well. Okay, so just be prepared for that. So here you can see the tongue. So this is the anterior two-thirds of the tongue, and this is the posterior one-third of the tongue. Okay, and here you can see there are a lot of papilla. Papilla means elevations, which is present at the junction of the anterior two-thirds and posterior one-third. This is called as circumvallate papilla. And in the posterior one-third, there is a tonsil, which is called as lingual tonsil. Okay, lingual. You already know there is palatine tonsils. Now there is a tonsil. Tonsil means lymphatics. So there is lymphatics which is present in the posterior one third of the tongue, and that is called as the lingual tonsil. Coming to the next part, any doubts until now?
No, doctor.
Okay, coming to the next part, the teeth. The teeth, there are teeth which are located inside the mandible and the maxilla. In children, it's called as milk teeth or deciduous teeth. Okay, the deciduous teeth or milk teeth because they fall off. Okay, so they start at the age of 6 months. Okay, then after 6 years, okay, the permanent teeth they start to begin in adults. So the permanent teeth they begin. Okay, and these are the number of deciduous teeth and the permanent teeth. Okay, so in the milk teeth, children they have four incisors on the each upper and lower jaw, so totally eight. Two canines on the upper and the lower jaw, so totally four. There is no premolars. Okay, four molars on the upper and lower jaw, so total eight. So if you calculate all these things, there will be 20 teeth in children. Whereas in adults, it's just the same except for the four premolars. Okay, so which adds up, and there is one more set of molars. So there are three molars, sorry, six molars on the upper jaw and six molars on the lower jaw. So totally 12. So totally, if you add, there will be 32 teeth for the adults. Okay. Coming to the next topic, the salivary glands in the oral cavity. The salivary glands, there are three major salivary glands: the parotid gland, the submandibular gland, and the sublingual gland. Okay, the salivary glands basically they secrete saliva. Okay, why saliva is so important? Because the saliva they help in lubrication. They also help in destroying some of the bacteria and germs, because the food might contain some germs, so they help in defense, they help in digestion, and they also help in taste. Okay, so they help when it is liquid, it will go and go inside and stimulate the taste buds. Okay, so that we will be able to feel the taste better. Okay, so that's the help of the salivary glands: parotid, submandibular, and sublingual glands. So there are three major salivary glands, one on each side. Okay, now this one we have already seen, so I am not going to cover much out of it. So there is nasopharynx, oropharynx, and hypopharynx. Okay, or laryngopharynx. Okay, so this is the laryngopharynx, this is the hypopharynx. So usually the food comes from the oral cavity into the oropharynx. Okay, and then it enters into the esophagus. Okay, the food is prevented from entering into the laryngopharynx because of this epiglottis. Okay, we have seen about this in the respiratory system also. Now, after the pharynx, the food enters into the esophagus. The esophagus, it is located behind the trachea. We have already seen that, and it is approximately 25 centimeters in length. Okay, it is continuous with the oropharynx, and it passes through the diaphragm at the level of T10 level, thoracic vertebra 10 level. This also we have seen. Okay, so it passes through the diaphragm at the level of T10. Okay, now the esophagus has got two sphincters. Sphincters means constrictions. Okay, so one on the upper level, which is called as cricopharynx. Okay, one on the upper level and one on the lower level. Okay, so the upper esophageal sphincter, it's called as cricopharynx, and the lower esophageal sphincter, it's called as a physiological sphincter. Okay, which helps in reflux. What is the meaning of reflux? Suppose if you eat too much of food, okay, and what happens? Sometimes and immediately you go to sleep. you can feel that the acid is entering into your throat back again. So that's called as reflux. Okay, so the reflux. So normally this reflux is prevented by the physiological sphincter as well as the cricopharyngeal sphincter. Okay, so if this reflux occurs, it is a pathological one. Okay, so sometimes when the person is sick, okay, or when he eats too much of food, okay, and then immediately he goes in for sleeping, the food might enter into the esophagus from the stomach. Okay, so that is called as esophageal sphincter. So there is an upper and lower esophageal sphincter. Okay, so the last one, I mean, after this we will just close down. So we are dividing the abdomen into 9 quadrants. Okay, you can see there are 9 quadrants. Okay, so why we are dividing it into 9 quadrants? Because for us to know where each organ is present. Suppose if someone comes with an abdomen pain, okay, so you can know like which organs are located in which parts. Okay, and then you can say like this problem could be because of this organ, because there are many organs which are present inside the abdomen. So that's why we divided into 9 quadrants by 2 vertical lines and 2 horizontal lines. The 2 vertical lines are called as mid-clavicular lines. Okay, mid-clavicular lines. And the 2 horizontal line, the one on the top, it is called as transpyloric plane, and the line which is passes below, or the plane which passes below, it's called as transtubercular plane. Transpyloric, transtubercular. Okay, so these are the lines. So these lines divide the abdomen into 9 quadrants. So what are the 9 quadrants? Let's look from the center. You know there is umbilicus, right? So this one is called as the umbilical region. Umbilical region. Okay, above this, okay, so this here is this place where the stomach is present. Stomach is also called as gastric. So since this is present above the stomach, it's called as epigastric region. Epigastric region. Okay, and this one, since it is present below the stomach, it's called as hypogastric region. So epigastric, umbilical, and hypogastric region. So three regions which are present in the center. Now on the sides, it's both right and left. Okay, so it's quite easier. So this is present below the ribs. Another name for ribs is chondriac. So that's why this is called as hypochondriac region. So there is the right and the left hypochondriac region. Okay, so right hypochondriac and left hypochondriac region. This is on either side of the lumbar vertebra. So this is called as right lumbar region and left lumbar region. Okay, so the two lumbar regions. Okay, then this is in the right iliac and this one is in the left iliac region. So there are 9 quadrants in the abdomen: epigastric, hypogastric, and umbilicus, right and left hypochondric, right and left lumbar, and the right and left iliac. Okay, so if a person comes with the pain abdomen, you ask the person where exactly the pain is located. Can you point with the finger where exactly the pain is present? Okay, so he might be pointing somewhere. Okay, say if he points towards the right hypochondriac region. Okay, so you know that there is liver in this side. Okay, so there could be some problem with the liver. Suppose if he points the finger towards the epigastric, you know there is stomach is present in this region. Okay, so there could be some problem in the stomach. So that's why we are dividing it into 9 quadrants. All right, so this is very important. So we will stop our lecture here. Okay, and then we will continue the rest in your next class. All right, you have any
Okay.
doubts?